Hi everybody, I am Dr. Britt Talley Daniel MD, neurologist and headache doctor. Today I'm talking about medication-induced migraine. Migraine is a genetic, familial-related neurochemical problem involving the thalamus, the cerebral arteries, and the trigeminal nerve. In the migraine process, the inflammatory neurochemicals CGRP, neurokinin A, and substance P are released, and they inflame brain structures. Migraine has many triggers, and certain medication can act as migraine triggers and make it worse. Medication-induced migraine. Medications that induce migraine include SSRIs, certain antihypertensive drugs, and estrogens. The chemicals in these drugs cause the release of inflammatory neurochemicals in the start of the migraine process. This talk is not about medications that are overtreated and which cause medication-overuse headache. Medication-induced headache is a process of overtreatment that builds up with time, usually in persons with migraine, to cause frequent or very daily severe headaches. Overtreated medication is an important but separate issue from which I'm talking. The drugs listed here cause a migraine headache to occur soon after taking a single dose of the drug, acting in this regard like a trigger. Many people are aware that environmental triggers like stress and caffeine often aggravate migraine, but few know that medications for unrelated and relatively benign conditions can also set off migraine attacks. I'm going to list classes of drugs that worsen migraines and certain one of the drugs. Antihypertensive drugs like worsen or epresiline. Birth control pills, oral birth control pills like orthonovin, estrogen patches, intramuscular injections of estrogen, estradiol, or like estrace, coronary vasodilators for angina like nitroglycerin or nitrates, histamine receptor antagonist like Tagamet, decongestants, certainly Sudafed, which is an Advil, Cialis, and Dristan, and hundreds of other drugs. Nasal steroids, for example, like Flonase. And I have a list of others listed on my blog at www.migraine.com. If you go there, you'll see the full list of these drugs. I'm just giving you the highlights. Bronchodilators like theophylline or aminophylline. Protein pump inhibitors, PPIs like omeprazole, like Prilosec. Of course, opiate narcotics like Vicodin, hydrocodone, tramadol. Then, tracking medication usage. Watch out for caffeine as coffee, tea, chocolate, etc., and BC powder. And a medication tip. Unfortunately, the most common of all medical side effects that any medication, drug, or supplement may cause is headache. It's the number one side effect. So it's almost all drugs can do this. Sometimes just tracking all your medication usage and stepwise eliminating one of the drugs will reveal the source of medication-induced migraine. So if this is helpful to all you, thanks for watching. Please click subscribe down there so we can follow each other. Look for me on YouTube for other talks on migraine. God bless all you persons with migraine, and I will see you on the next talk.